So first of all, can you just tell me who you are?
My name is Amir. I have been the executive director of Amir Quebec for the past 21 years. A long time, but I think that maybe this is a testimony to at least my sentiment towards the organization and my feeling that there is still lots of work to do.
Great. Can you tell me, just for those people who might be unfamiliar, what is Amir Quebec?
Amir Quebec is the first family association in Quebec that started some 34 years ago in an attempt to help families and friends who have a relative with mental illness to basically negotiate the challenges of mental illness. So we offer a variety of programs including support, counseling, education, information, in variety of formats to basically to reach out to families wherever they are.
Okay. Could you give me one or two examples of the kind of programs that you do?
We have probably around 12 support groups every month. We have support groups for families only, so there are only family caregivers can come to these groups. But we have many mixed groups, such as for depression, for obsessive-compulsive disorder, for anxiety, etc. So we welcome anybody with a diagnosis, as well as people, relatives of these people, to these different groups. And basically, from time to time, we adjust the groups according to the interests and the demands of our members. But many of these core groups remain for many years because they address needs that many caregivers have.
Okay. And what happens in practical terms in these groups? People come to your offices and they meet in the evening, or is it the weekends, or
right?
What do you discuss?
Well, the support groups are usually in the evening, and they are not even in our office. We use the premises of the Jewish General Hospital. There are really open agenda meetings. We have a facilitator, which is usually a family member, or maybe someone with mental illness, if this is really just a group for people with lived experience. But it's usually peer-led. So it's self-help, peer-led groups with no preconceived ideas. So people can bring whatever issues they have. They can share their experiences. They can ask people to share their experiences. It's not unlike the education programs that have a focus and have some pre-planned agenda. The support groups are very open.
Okay, that's great. If people are interested in these groups, how do they enroll or find out more?
People can come and go as they wish. We usually advertise it in a variety of venues. We have a newsletter that we publish 4 times a year, and it goes to our families, friends, members, professionals, etc. We also advertise in newspapers, in the radio, and so on. So for the support groups, people don't have to advise us. They just go there. For the education programs, people do have to register. If they are members, it's free for members. If they are not members, we expect them to become members. But I need to say that there is also a complimentary membership for people on limited income. So we will never turn away anybody because of difficulty to pay. The education programs are usually 6 consecutive weeks. We offer mood and thought disorders and also an education program on obsessive-compulsive disorder. And they include explanation about the illness, the course of the illness, treatments, medications, other treatments, treatment modes, how to cope with the different demands of mental illness, how to communicate, problem solve, etc.
From what you were just saying, and I know being involved in the mental health community in Montreal that you're very respected and active organisation. Could you tell me a bit more? I think you have a newsletter, you have a website, you have members. Do you have like chapters? And I mean, how many members? How often
Right.
is your newsletter? Just kind of.
Yeah, well, it's a little difficult to say how many members we have. We have about, I would say that we have about 1,000 members. We have 600 or 700 registered members, but many of them are family membership, so there are at least 2 people. But there are lots of people who come to support groups, for example, or to other programs and don't necessarily become members. We do encourage people to become members, not only because it's an income, which is very limited income for us, but it's really a vote of confidence, a vote of support, and it's really important when we do go to the government, for example, or if we go to foundations or to any funders, potential funders, they want to know how many people we serve and how many people are put their trust in us. So it's we encourage people to become members. Yeah.
Okay. And you've got a lot of experience as executive director, and you also, we were talking earlier that you're a doctoral student and doing research. Maybe could you just say what you think are the biggest challenges facing family or people with mental illness in Quebec today, and what any advice that you could give people, or any
Well, this is a very big question. It's a very big challenge to answer about, to this question. I think that one of the maybe the most challenging situations for families is really to be recognized as people in their own rights and people who do have needs for support. I think that it's important to recognize that people with mental illness absolutely require services and supports, but the families require it not to a lesser degree. For 2 reasons. One, if they're really expected to care for their own relatives very often long term, it's really important that they get the support and the tools in order to do that the best way they can. Additionally, caregiving takes a really toll on the well-being of the caregivers. So it's very important that caregivers will be supported in order to mitigate the negative consequences, the potential negative consequences of caregiving. So it's really, if you want to look at it, it's a double whammy that caregivers are subjected to. One is their caregiving responsibilities, but the other one is to protect the integrity of their own well-being. And for that reason, I think early and comprehensive support for caregivers is critical. I think that it's critical for the trajectory of mental illness in their relatives, but also for their own well-being.
I think my last question is, do you have any need for kind of volunteers, or if people have spare time, students or people with mental illness who aren't working, for example, do you integrate people like that into your program?
All the time. We really operate on a shoestring budget, if you will, and we wouldn't be able to be here and do what we do without the many volunteers that we have. We have probably 150 volunteers in different capacities, of course, starting from being on the board and committees and so on. But the facilitators of support groups and the education programs are volunteers. We train them, we support them, but we have volunteers who are involved in all aspects of the organization's life. So yes, absolutely, we always look for volunteers. We have translators volunteer translators who really take, if we had to pay for translations, it would be costly. So we take advantage of the expertise and the goodwill of volunteers in all levels of the organization's life, and we encourage people to become volunteers in different ways.
Okay. And if people would like to volunteer or learn more about your programs or services, is there a phone number or email?
Well, absolutely, yeah. There is a telephone number that they are welcome to call. It's 514-486-1448. And of course, they are welcome to visit our website on www.amirquebec.org.
Okay. Well, Ella, it's been a great pleasure to meet with you today and to discuss these things. And thank you for your time, and also thank you for the service you give to people with mental illness.
Thank you.